Yeah, beat your addiction, live free. Ralf Friedrichs is who you see. Listen in when you're feeling low. Take back your life, today's show. Beat your addiction, live free. Ralf Friedrichs is who you see. Listen in when you're feeling low. Take back your life, today's show. Stay positive, hope, and keep faith. Stand strong against any odds that you face. Put away the alcohol and the drugs. Fill your time with the things you love. Addiction is tough, but it's worth the work. Treat your body what it's worth. Spread positivity, inspire all. If we stand together, we will never fall. I help others see the other sides of life. A sober life, letting go of the strife. So give me a call, I can help. 1-844-4405-HELP. Homeless shelters, hospitals, jails, wherever you are. I am Ralf Friedrichs and I am here for you. 1-844-405-HELP. Yeah, change your future, it starts today. Live life to the fullest, never skip a day. Create hope, spread positivity. Beat your addictions and negativity. Ralf Friedrichs is here for you. Call today so we can help you. 1-844-405-HELP. 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 We are here for you. Call us today.
Hello, my name is Ralf Friedrichs. I'm an addiction recovery coach and host of the Take Your Life Back Today show. As an addiction recovery coach, I want to share something with you, and let me leave an everlasting impact upon you with this. Just imagine being buried alive. You're in a coffin, but you know you're not dead. You don't know how to open the coffin, so you start pushing on the lid, but the enormous weight upon the lid is just too heavy to open that lid up. You just think you're going to die, but then you think about banging on a lid, and maybe you can unsettle the dirt, and maybe, just maybe, someone from on top might start digging their way down to help you. This is what it's like to find yourself at the lowest point of alcohol and drug addiction. You know you need help, you know you can't do it on your own, but you don't know how to reach out for help. In reality, there are people standing by your grave willing to help you. You just don't know that. You just think you're going to die. Usually, though, people don't think about death when they're habitually abusing drugs and alcohol. In order to feed an addiction, you have to be great at repressing the fear of death. With this, I leave you with one last thought. Don't be the person that reaches out after it's way too late, like the people or the person on these index cards. Instead, reach out while you have a chance. Reach out while you can. Reach out and just say, I need help. With this, please call me at 844-405-HELP, and I promise you, I will help you take your life back before your life is gone. Folks, please call 844-405-HELP. I promise you I will help take your life back. People like Larry Geis from the Geis Academy at 516-458-2741, 516-458-2741. Larry Geis is an addiction recovery coach, a life coach like I am. Him and I always tell folks like you, it doesn't matter where you came from, it doesn't matter where you've been. What matters most is that you are reaching out and you're asking for help today. Call Larry at 516-458-2741. That's 516-458-2741. Larry Geis can also be found at www.odysseyconsultant.org. That's www.odysseyconsultant.org. Larry Geis from the Geis Academy will help you from your depression to happier times, from low self-esteem to raise your self-esteem, from addiction to a life of recovery. He will help you take your life back, but you need to reach out to him at 516-458-2741. Larry Geis from the Geis Academy. I just want to say a special thanks to my brother-in-law, Kevin, my sister-in-law, Belinda, her children, her child, Kelly Rose, and their grandchild, Kaylin. I just wanted to say thank you very much for visiting us. I hope you all had a good time. Caden, I know you loved those sunglasses, and I hope you enjoy them. And the ones that I made you for your football game, enjoy those as well. And we will miss you, but I promise you all, Kevin, Belinda, Kelly Rose, and Caden, I promise you that and Casey and myself will be coming down to Virginia within a month to make a special visit to you, and we can continue enjoying each other's company. And I really thank you for coming up, and thank you so much. And with this, because family unity is so important in children, I want to talk about how hospitals are treating babies caught in the crosshairs of Alaska's opiate crisis. A troubling side effect of Alaska's spike in opiate abuse is getting increased attention from healthcare officials nationwide. Babies are born addicted to drugs who go through withdrawal in the first days of their precious little lives. In Anchorage and elsewhere, hospitals are adapting in an effort to better treat newborns. In late 2014, Alaska Regional Hospital opened a 4-bed facility specifically for babies exposed to addictive medications and drugs like heroin while in the womb. If ever there was an innocent being, it has to be the innocence of a tiny little baby, said William Trawick, a neonatal nurse practitioner who works for Alaska's Neonatology Association and led the effort to create the specialized unit at the Alaska Regional Hospital. They don't deserve anything like that, he says. They can't understand anything that's going on. And at a Providence, Alaska Medical Center, there are plans to place a similar setup. In the meantime, the hospital has sought quiet, dimly lit spaces to monitor babies going through withdrawal symptoms. The anesthesias of the bright and noisy neonatal intensive care units that were standard in the past are up and rising. Rise in prenatal opiate use. Prenatal exposure to opiates is on the rise, not only in Alaska, folks, it's nationwide, and Alaska is no exception to this trend. As a result, babies can be born with neonatal abstinence syndrome, or otherwise known as NAS. The withdrawal can be horrific for the infants, and long-term effects aren't well understood, Trawick of the hospital said. Symptoms can vary, including but not limited to fever, trouble sleeping, slow weight gain, diarrhea, excessive crying. Seizures are less common, but ominous, Trawick says. I was really shocked on how little we knew in the terms of the number of babies that were affected by these symptoms. And then even looking at how little we knew how many babies there were, we are now educating ourselves while helping these babies. Since Alaska's Regional Neonatal Abstinence Evaluation Support and Treatment, or otherwise known as NEST program, started in October of 2014, 33 babies who are experienced significant withdrawals staying in one of the NEST rooms as early as April of 2015. From 2014 to 2015, 97 babies were admitted to the Providence NICU, had NAS staff say. It's a big topic of discussion here in the hospital, said Dr. Mary Alice Johnson, the NICU medical director at the Providence Hospital. Everybody is concerned about the fact that we are seeing more moms exposed and therefore babies suffering from the neonatal abstinence syndrome, otherwise known as NAS again. Statewide, the NAS rate saw a 5-fold increase from 2001 until 2012. From less than 1 to more than every 5 for every 1,000 births, according to a February bulletin from the State Department of Health and Social Services. Cases were pulled from the Medicaid claims and the hospital discharge database. Incidence rates were highest in Anchorage and Southeast Alaska, according to the hospital's discharge data. Treating these babies can be very expensive, too. From 2001 to 2012, the average hospital stay for a NAS baby was 16 days with an average hospitalization charge of $88,869. The DHSS said Medicaid foots the bill for many of these NAS cases. Specialized care. Alaska's Regional's NEST unit is touted by one of the facility of the NAS treatment in Alaska. Alaska Regional was the primary funder of this, but the hospital did get a $75,000 grant from Alaska Mental Health Trust Authority to get the unit up and running, said the Alaska Regional spokesperson, Kiesian Lastufka. Sound, dampening, ceiling tiles, and dim lighting decrease stimulation for the baby. Rocking chairs in the rooms and sleeping accommodations for the parents are for baby and parenting bonding. We're trying to be less institutional, Trawick said. A mobile with pink and blue birds hung from a crib near where he stood and one of the nest rooms during the early April interview. We try to make it look as a little bit more peaceful and baby-like, less institutional. A baby with NAS may have their own dedicated nurse assigned to them, providing almost instant availability should the infant need anything. You can't tell these babies, wait a minute, we'll be right there, Gilly said at the Providence. Staff have identified a couple of the large private rooms that could be adapted to the house babies with NAS and allow mothers to be near their children 24/7. A business plan has already been written up and has received support, said Sharon Liska, clinical nurse specialist at the Providence Hospital. We've identified work that needs to be done as far as keeping the family unit together, she said, and part of that special care nursery we're working on right now is to outreach to the NAS families. Heroin is one of the most common drugs Providence and Regional C that causes NAS. Methadone, Subutex, and other prescription medications obtained legally and illegally also crop up. Neonatal abstinence syndrome looks the same regardless of the avenue that opioid got to the kid, said Johnson, noting that some newborns may have painkillers in their systems if they underwent surgery. Hospitals everywhere are grappling with how best to treat these babies with NAS. Trawick said that he and others recently got back from a trip to Canada where they learned about varying approaches to NAS. There is an effort to standardize some protocols. Providence, Alaska Regional, and 4 other hospitals in Alaska have a Center of Excellence in NAS education and care designation through the Vermont-Oxford network, according to the Providence spokesman Mike Canfield. There's also a scoring sheet that quantifies the severity of the NAS patient, but Trawick says that it may be overhauled for more excellence. Pharmacology care, such as morphine, can be used, but Trawick says the fewer drugs prescribed, the better for the child. Involving the family. At 2 Anchorage hospitals, staff say shaming the mothers is never okay. The goal is to promote bonding between mother and child and educate the parents. You cannot lose sight of the fact that they are human beings and they just had a baby. Trawick said, and to everyone else, that's a great experience and should be a happy time for them. But for them, it's a very complicated time. Hospitals are required to report positive drug screenings of mothers and children at the Office of Children's Services. What OCS does after that isn't something hospitals control at all. A positive screen doesn't necessarily mean a child will be whisked away from the mother. The goal is to keep the mom with the baby as much and as long as possible, said Graham Hopewell, clinical nurse educator at the Providence Hospital. Johnson, the NICU medical director at the Providence Hospital, says a lack of resources for mothers looking to get clean exacerbates Alaska's opiate problem. Recently, the state's 2 inpatient detox centers suspended new admissions because of the changes in federal regulations. The Ernie Turner Center in Anchorage and the Gateway to Recovery Center in Fairbanks have since said they will change their procedures to start admitting new patients for opiate detox. Moms can come here and reach out. They want to get the help, and they want to get the help without any repercussions from anyone or any judgments from anyone, Johnson said. The providers before us, the providers after us, is a huge component to the success of families, such as the mothers and the children together in a bonding environment instead of a judging, hostile, shameful environment. This is how Alaska's hospitals are treating the babies when they're caught in the crosshair of opiate use. Remember, the troubling side effect of Alaska's spike in opiate use is getting increased attention from all over, not only Alaska, but the nation, from healthcare officials. They don't deserve anything like this, someone said, about how mothers are treated when they come into hospitals. And remember that if the mother is taking any sort of opiate drugs, the child-to-be or the child in the womb is certainly getting it. There is a huge rise in opiate use in the state of Alaska and also in the nation. You got to remember that what I read before, that in 2014, there were 33 babies admitted who have experienced significant withdrawal symptoms at birth. Remember this now. Between that year until 2015, it rose up to 97 babies. That's triple the amount. A specialized care is a necessary thing at Alaska's Regional Hospital, and they performed or invented a thing called NEST, which granted them a $75,000 grant to help modernize all these situations. And last but not least, we need to make sure that we involve the family. And involved in family is not just the mother and the baby, the bonding in a stable, smooth, or soothing environment, but it's also to get other family members involved, such as the father and grandparents. The goal is to keep the mom with the baby as long as possible. And another goal is to make sure that the mother gets educated to prevent future children from coming into to earth, or I should say coming to life, with the mother abusing her body with drugs and alcohol, because remember, whatever the mother intakes, whether it's through the throat, the nose, will, or through the blood, will be transferred to the child. And we need to make sure that we educate not just the mothers, the fathers, but all family members. Folks, it is this simple. If you're pregnant, first of all, I don't promote drugs at all for whoever, but if you're pregnant, remember what goes in here, or in here, goes in here to the baby. Now, if you feel okay with that, if you feel okay by smoking pot, if you feel okay by snorting crack, if you feel okay by injecting into your arms, knowing that your child that's in your womb is being affected, then shame on you, and I hope to God has mercy on your soul, because whatever you do affects your child. Folks, it affects your child. Get educated. It's not just a trend in Alaska, it's a trend in your own hometown as well. That's what people like myself and Larry Geis and thousands of other life coaches, detox coaches, addiction recovery coaches are here for, us to make sure that we send you the message. I am not perfect. I certainly had all my troubles with alcohol in my years, but I have become sober, and during my sobriety and my rehab, and this is my rehab, it is to educate myself, because when I educate myself, I can educate you folks. I can give you the information that I read about and I absorb in my own mind and let it go through my mouth into the camera for you to hear, and it's all done for the better of all of us as human beings. And I hope to God that we all serve each other in some sort of loving, caring, informative way of life. We're put here on earth for a lot of reasons, and one of those reasons is to love each other, to care for each other, and to help each other. And I hope to God that you all got some sort of understanding on how bad, not just in the state of Alaska, but how bad opiate usage is, not only with a lot of humans, but with pregnant women. And the biggest problem that we are faced is that these ladies, or these fathers that are with these ladies, are not educated enough to understand how bad it is to transfer the alcohol and the drugs through the blood system into the baby. But here, hopefully today, you got a better understanding. Please do go to the Mayo Clinic or the CDC or the Fix or Sober Nation, and in the search bar just type in prenatal opiate abuse, and you will educate yourself even further than what I could have so quickly said on this video. Again, I just want to say thank you to my brother-in-law, Kevin, sister-in-law, Belinda, their daughter, Kelly Rose, and their grandson, Caden, for giving us all a good 3 days. Happy time. Family unity, family bonding is so very important, and we certainly had a great time. And we're going to miss you, and I hope you have a safe trip down to Virginia. But I promise you, and Casey and myself, Uncle Ralph, will be coming down to visit you within a month. Folks, I hope you all have a great day, but I hope and I pray that you all have a sober rest of your life, a caring rest of your life. And remember, what is in your body, such as a child, and you put into your body, will get to your child. And please reach out to God and let God help you. If you, for some reason, think it's okay to smoke, drink, do drugs while pregnant, you shouldn't be doing it at all, but definitely not while pregnant. So reach out to God. Let God support you. Reach out to people like myself and Larry Geis. We are here. I am at 844-405-HELP, and Larry Geis is at 516-458-2741. Together, we will all stand and help each other, and together we will help each other take our life back. May God bless you.
Yeah, change your future, it starts today. Live life to the fullest, never skip a day. Create hope, spread positivity. Beat your addictions and negativity. Ralf Friedrichs is here for you. Call today so we can help you. 1-844-405-HELP. 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 We are here for you. Call us today. the show is over, but your life starts today. Taking back your life's the only way. Keep faith, stay positive, push through. Take back your life, it starts with you. Alcohol and drugs can't control your life. Let go of the negative and the strife. Ralf Friedrichs is the man guiding your way. The show is over, but your life starts today. Call Ralf Friedrichs at 1-844-405-HELP. That's 1-844-405-HELP. We hope you love the show today and tune in next time. Take back your life today show with Ralf Friedrichs.